but it's called the SOAT. If you look it up, it's in the Journal of Athletic Training. It's in the Journal of Allied Health as well. But it's the grading sheets. You guys had access to the taping grading sheets also? They gave it to you to take a look at? TSAIs, yeah. So Dale and Mark both did grading sheets. I did that as well for my study. And so the point is, like I mentioned before, you need to know what your goal is, what the destination is before you even start driving the car. So in a way, we're giving you the destination by giving you the grading sheets. People will argue that's cheating. Probably it's cheating. The way you do your quizzes, people argue that's cheating. I think it's opening up discussion. People learn better when they talk about it rather than just read it. Sometimes even just sitting here, which is what I don't like to do a lot, and you guys sit here and you're just listening to the whole time, that really doesn't help too much. A lot of people are comfortable and familiar with this way though, but it's not the best way. So in saying that, this is Mark's SOAT, the grading tool for the clinical assessment classes, lower body. I have them for the upper body. I will post these on Blackboard. You will have access to them. You will use exactly the same thing for your exams. We tried to get the CAT to buy in because this was developed not just by Mark, but with the help of 10 other people across the country that work at each one of the institutions. It was a collectively built tool. So it's what everybody thinks we need to do. Essentially is what this is. Okay? So this is called the SOAT. And the way it's broken down is you have rating scales, so that, 0 means something, 1 means something, and so on. So there's a 5-point scale, and there's a 0, 1, and 2 scale. The simple one, it was not done, or you failed to do something that was supposed to have been done. Right? So if you forget observations, you'll get a 0 because it wasn't done. But in some situations, some of these items, we call these items, grading sheet items, some of these aren't really applicable in some scenarios. So that the left is not applicable, which they're not counted towards your grade. But if there was something that you were supposed to do that you didn't do, then we give you a 0. If you did it, it was done perfectly or well, we give you a 1 because you tried it at least. But that tells you that I need to get better at it. If you get a 2, you did it at our expectation level. Okay, that we use for more specific items, if you will. So, an example. Active range of motion planner question. Did they do it? Yes. Did they do it well? Yes. They did it, but they can get better. We'll give you 1. For more broad questions, so range of motion was adequate. So not specific plantar flexion or dorsiflexion, but range of motion in general was adequate. Obviously that houses more criteria to get a good grade on that particular item. But there's a bigger grading scale for that. Okay. So it's similar to like you get an A, B, or C. It kind of gives you an idea where you are on that spectrum. So the first few boxes are all 5-point scales because this first page essentially is a summary of the entire assessment. So that's on the front page. I normally just flip that right away when you start. Okay, because the individual pieces you need to be able to perform are on the following sheets. So this is professionalism, this is leadership, teamwork. The ones that are blacked out are not appropriate. So confidence, overall demeanor, patient comfort, and communication with the patient. We've talked about that before. And because that's just an overall general impression, there's no specific things I'm looking for, just an overall vibe that I get from watching you, it's on a 5-point scale. Normally, we give some comments as well that will help you in those boxes. But these are the sections of the entire grading sheet, and under each one of these sections, there's other items that are more specific. So this is general. So nature of the injury, there's about 7 questions on nature of the injury. Did you ask them all? And did you get the information you were looking for on a 5-point scale? So each one of these, there's sub-items underneath them. This is HOPS. History, observation, special test palpation. And then overall, decision making. Did you make a good decision on what you thought it was? Professionalism, leadership, and then thinking out loud. Were you comfortable verbalizing everything? Okay. Based on this, so the way it works is we grade all the fine items. We summarize the sections. We give you a grade for each section. From this, we grade overall, how was your history taking? Overall, how was your observations? Overall, how was your palpations and special tests and so on. And then from here is typically how I come up with a grade for you out of 10. Okay? So that's how that's used. Now, the specific details that we'll be using are here. Okay, so a lot of these things you've already seen on the PowerPoint. That's your checklist. The goal is to get it all done. How you organize it is up to you. Okay? But that's going to come with practice. You're going to find sometimes your history like, that was all over the place with that. It jumped around a lot. And others will be like, that went really, really smooth. Okay? So these are nature of the injury and pain. I always start off with these two first. That's just me. And then patient information is down here. And then safety, rehab, understanding is down there. Okay. That's history. I'm just going to fly through the other sections quickly. What's this for? And this is suspicion. So what you say, I write down. If you don't say it, it stays blank. To remind you that you need to state your indices of suspicion each time. And there's one of those boxes after each section. Under observations, because this is lower body, this is more specific to the lower body, and this is just the tip of the iceberg. Depending what condition we give you, we'll add more stuff in here to see if you verbalize it. Okay? Pelvis, ankle stuff, knee stuff, foot stuff. Did you observe from the side? Did you look anteriorly, posteriorly, and so on? And did you check dynamically as well? That's gait. And then scanning and clearing is on the right side over there. And so depending on what we give you, scanning might be not applicable for the condition we give you if it's an acute injury. So I just put a line through this. We don't even use that box. But we're looking to see if you clear the joint above and below at least for an acute injury. Okay, and then from there, dermatomes, myotomes, reflexes, again, if that's applicable. And then range of motion testing. So we see, well, I'll let you know if you got all the ranges of motion that you were supposed to test. Okay? So, let's see. That's lumbar spine. Flexion, extension, right side flexion, left side flexion, left rotation, and right rotation. This is hip. Flexion, extension, adduction, internal rotation, external rotation. Knee, flexion, extension, internal and external rotation. Ankle and toes, flexion, extension, adduction. More so MTPs, metatarsal phalangeal joints for adduction, adduction. Okay? In some cases, if this is a scanning exam, we typically do everything for a chronic condition. So as you can see, this does take a lot of time to assess all the joints. There are shortcuts. You'll learn the shortcuts in the winter. Say your indices of suspicion, because the indices that you state will determine what special tests you do. I leave this blank, because depending on what you write, I look to see if you actually tested for it. And then palpation. There's just a list of structures there. There's no guidelines anywhere, honestly, especially for the CT exam, of how many things are you supposed to palpate. So there isn't anything written down. Depending on the injury, I probably suggest the injury itself. Your indices of suspicion at least. If it's an ankle injury, Ottawa ankle rules, there's 4 spots you need to put your fingers on. If it's buffalo, there's another 2 on top of that. And that would be the bare minimum. So I typically would say 10 to 15 spots, just to cover yourself. Don't go by that as like a rule in stone. But definitely palpate your indices of suspicion, because your palpation skills is a tool to rule things out also. And then your conclusion: correct diagnosis, process, how was it, and did you refer? And that is the grading sheet. Okay. Do you guys have questions about anything on the grading tool? Okay. Take that as a note. So what we'll do is you guys will practice. Partner up just with the person sitting right beside you for now. Again, we're going to switch around as the day goes through, and as Monday, we do stuff on Monday, we'll switch partners often. But think about an injury that you've had before, and the goal is at least to think about those 4 categories of questions you would ask. And just right now, ask as if you're just asking as a friend. Start off with that, because that's the type of normal conversation you want. Then, when you can't think of any other questions, then go back and think about, okay, what else can I ask that's under this section? What else can I ask that's under that section? And so on. Okay? Once you're done, whoever the model is, whoever's giving the information, try to keep track of what else this person could have asked. And then we'll share that information when you're done. Okay? You only get 15 minutes, and then we'll switch. Okay? So, whoever the patient is right now, think of something that has happened to you in the past that your friend does not know about, and that is your injury. Think about what you were doing at that time. Were you a student? Were you working? And anything in your past, whether it be hospitalizations, any other accidents, you can use in this as well. Okay?
Oh, I think that. No, you want to go first? Sure, no, I can be a patient.
Hey, what happened? Are we doing acute or chronic?
Stop for 1 second. And don't move. Look at yourself. Are you professional looking? Continue.